Welcome back, everyone. I hope these poster sessions and the breaks are keeping you energized and connected with all of the people who are here. We want to take the next about 45 minutes now to just reflect on the progress that is being made to get to cleaner air for everyone around the world. We hear a lot of times headlines and news stories about how air pollution is getting worse, millions of people are dying, and all of that is true. But it is also true that we are seeing incredible progress on clean air initiatives around the world. So we will try to do a whirlwind tour of initiatives across sectors and areas of work and people that are engaging on the issue of air pollution. And because this is a very global panel, we have 2 people in person and then 3 people joining us online. We will be talking to people from across 5 time zones and 5 continents. So hopefully everything will work, all the connections will stay. But I would like to welcome Juan Castillo, who is the Regional Air Quality Advisor at the Pan American Health Organization. He's been working on technical cooperation with health officers across Latin America and the Caribbean to strengthen capacity around air pollution and health. Welcome, Juan. Very nice to have you here. I would also like to welcome Nina Renshaw, who is the head of health at Clean Air Fund, where she leads the global health portfolio, engaging with people across various fields, but intersecting around the issue of health and air pollution. Welcome, Nina. Online, we have Karma Yangzom, who is joining us from Jakarta. It's very late at night for her. So thank you, Karma, for joining us. She's the Principal Environment Specialist at the Asian Development Bank, and she manages ADB's Asia Clean Blue Skies program, which is funding initiatives, infrastructure to clean up the air, to build air quality monitoring infrastructure, and she'll tell us more. And then we also have Jane Akumu, who is joining us from Kenya. She's a program officer at UN Environment Program and has worked for the last 2 decades on solving the transportation problems in Africa and thinking about creative policy-based solutions. So very warm welcome to our panelists, both in person and online. I'm hoping we can bring them up now so we can say hello to them. And I'm also very excited to have Martina Otto join us. She is the head of the Secretariat for Climate and Clean Air Coalition, and she's worked for over 25 years in environmental policy program management, focusing on a variety of issues that we've talked about this morning: energy, buildings, transport, regional cooperation, finding funds to do all of the work. So I'm very, very excited, Martina, that you can be with us as well. What we are going to do is take a few minutes to hear from Martina about a new, very exciting global initiative that Climate and Clean Air Coalition has launched. And then we will speak with our panelists and hear about the progress that they're seeing in their places. It's a very short session, and we will try and keep it as fast-paced as possible. So if you have any questions, just hold on to them. We will try to find a segment in between, and I will request that you keep your questions very brief, and then do lots of follow-up with all of the amazing people here. So without further ado, Martina, over to you for your remarks.
Fantastic. Thank you very much for this nice welcome. And it's a shame I can't be there in person. I hope you do hear me okay. I don't think I need to convince anybody that air pollution is a serious issue. And I have a feedback. I don't know whether you may be able to switch that off. It's disturbing. I don't know. Technical.
Yeah, is it better now? Can you try? We hear you okay.
Yes. Yeah. Well, actually, no, there's still the echo coming in the back. There's a feedback. Oh. I mean, if the sound is okay for you, then I'm happy to. Now it's gone. All good. All good. Here we go. Okay, so take 2. So I don't think I need to convince anybody that air pollution is a serious issue. You have alluded already to the numbers that we all know: 7 million premature deaths, 9 out of 10 people breathing air that doesn't meet WHO guidelines. And it really comes at a huge cost individually to health systems and shaving off GDP. And the cost here that we look at is equivalent to about 6% of global GDP, according to a World Bank study. And And that means we need to take action. But it's not only about human health, it's also about the triple environmental crisis. In the end, it's one atmosphere. We see soot deposition on plants that inhibits their capacity to do photosynthesis. Ground level ozone impedes plant growth, and so on. So there's a huge issue going beyond, and there's really a sort of negative feedback loop as well. If we look at global warming spurring wildfires, and from there we get more pollution again, and similarly desertification contributing to sandstorms. So there's a real negative feedback loop, which means we need to look at integrated solutions. And this integrated approach that in the CCIC we're really promoting is a way forward to get to a double dividend. And at times of these multiple crises, I think it's really important that we look at solutions that do give us a double dividend, because that in the end gives us the confidence that we can do this. But the responsibility really is on us to break what at the moment is a bit of a vicious cycle into and turn it into a virtuous cycle. And to do that, we need to step up our game. But we've also seen a lot of good action already, and that gives us further hope that we can do this. What we need still is a bit of a breeze of fresh air in the way we take on the issue. And that means steering away from a bit of a fatalist approach where we simply accept that we have to put up with bad air in the process of growing our economies. I think we have proved now as well that we can do this differently. And we have seen amazing examples of countries having halved their air pollution, or cities having halved their air pollution levels already. And that means we have to tap into those technologies, but also we have to do a bit of a paradigm shift and see clean air really as an asset that is worth investing in as well. And well, you alluded to that already a little bit. We need collaboration here. And that means between the health ministries and the environment ministries, the whole community, the two communities, health and environment, but also looking at across the industry sectors. And I think it's amazing to see then what the panel will tell us, because there will be a lot coming out of this. So it's about transport, it's about waste, it's about agriculture, and really cutting across all this. And the collaboration is not only across sectors, but also across regions, because air pollutants do travel and they don't know any administrative boundaries. So action at home is just as important for better air at home, but also not to impact neighbors. In the end, it's a matter of how the wind blows, and if we can do something here to avoid the crossover, that's even better. And here, the collaboration is not only on the impact side, but also on some of the solutions, so we can really work together, sharing of good practice. And you mentioned, well, the CCAC has a new initiative, that's the Clean Air Flagship, that was launched at the last COP. By all the ministers representing the countries that are gathered in the CCAC, now over 170 members, and that's countries and non-state actors. And we've taken that really on board, looking at, on the one side, regional cooperation, and there's something that's really amazing with helping regions that do not yet have regional cooperation arrangements in place to do so. So that's a key area. There's also something that's the air quality management platform that we're pushing and working on. We will look at the economic case, just as a feedback to what I said at the outset about changing the perception and taking air quality also as an asset. And there's a work stream on private sector engagement together with the World Economic Forum and Clean Air Finance Sprint, because we know as well that less than 1% of international development funding and about 2% of international public climate finance is going into air quality work. And obviously there's a laudable exception to this, and we'll hear from Karma a bit later about the leadership that the ADB is playing here. But I think we really need to look at that very carefully as well, how we push things forward. And the solutions are there. It's on us to have the policies in place and to make sure that the finance is in place as well. And here really a special emphasis on the finance between central government and local governments to make sure that they can fully use as well their jurisdictions. So that's a little bit where things are headed. And again, I'm really excited about the Clean Air Flagship, but it's also a way to make good on political momentum that we have seen very recently at the last UN Environment Assembly in Nairobi, where a new resolution was passed that really focuses on the transboundary nature of air pollution and the regional cooperation in particular. So I think we see things coming together. A lot of good examples of what is happening at the local level, at the national level, within finance institutions, and this political momentum as well that is sort of unfolding to make sure that we're not leaving air quality as an issue behind, because we've seen great advances on climate in terms of the political momentum, in terms of biodiversity as well. And now it's really the time for this, and that's the year of clean air. It's time to highlight the importance of the issue, but also to see how we can embed it as well as possible into other issues. So any infrastructure finance should actually, in any infrastructure decision-making, should actually factor in how we can do better on air quality as well. So it's that way that I'm talking about the mainstreaming. And it's really all about collaboration in making this happen. We know what we can do. We just have to really put our will to it. So that's a little bit where I would like to leave you with, and hand over to the panel, because now we get all the good examples of what has been happening in the key sectors. Thank you.
Thanks a lot, Martina. I think you've set us up really well, because now our panelists can tell us about recent successes that they've seen in their fields and where they're seeing new collaborations. So, Juan, I would like to start with you.
Thank you, Pallavi, and thank you, colleagues. I'm really excited about being here today. We're thinking what is important to have a global panel on air quality and health, right? And we were talking about transboundary pollution, and now we know that traditionally we were thinking about transboundary pollution just about European countries, but now we know that it's going around the globe. But pollution is not the only thing that goes around the world. Our ideas and solutions is also something that we can share, right? And the experiences that are being portrayed today is like a great opportunity of see what countries are doing, what cities are doing, and what is working and what is not working. And this conversation will help us to go further. In the Americas, I'm coming from the Pan American Health Organization, that is the regional office of WHO for the Americas, and is also the Health Secretary of Health for the Americas states. 18% of PM, during the last decade, 18%, we have experienced a reduction of 18% of PM 2.5 in the Americas. 1.5 million people has got, in the last 4 years, has gained access to clean household energy, phasing out biomass burning. And we also have like 104 cities monitoring air quality in 22 of our 35 countries in the region. So we have been making some progress on that. And actually, at this time, we have like 12 countries in the region that are discussing new air quality regulations based on the WHO air quality guidelines. But I would like to highlight two stories briefly. One is a work that is being done in Central America. This is the countries that are in Central, this is the Inter-Central American system that includes countries in Central America and the Dominican Republic. This is Honduras, Guatemala, Belize, Nicaragua, Panama, Costa Rica, and the Dominican Republic. So these are all kind of small countries that now they are working together towards a harmonized regulation, harmonized capacity building also, so they are able to estimate the health impacts of air pollution and prepare like actionable action plans. Actually, they have an integrated roadmap on air quality, short-lived climate pollutant, and health that now they are implementing together with the collaboration of different technical cooperation organizations. And also, I would like to talk a little bit about Barranquilla. That is one of our lead cities that where we are doing a lot of work, and we can see the power of the transformational power of leadership, right? So we have these mayors in Barranquilla that during the last probably 20 years have been investing in improving the city, like doing city-level intervention, like a boardwalk, improving transportation, improving like access to green urban areas, and all these policies that have been prepared as an urban development policies, we know that have an impact on air quality, that has benefits for air quality, climate change mitigation, and adaptation. And now we are working with the city to estimate the benefits of this, the health benefit, the health gains, and the city is advancing in a more consistent way to improve air quality and health, and it's like having a renewed leadership on that. Thank you, Pallavi.
Thank you, Juan. So more monitoring stations, lots of good leadership, and I think all of that connects with financing. So Karma, I will turn to you as someone who's been thinking about air quality in large-scale infrastructure projects and other activities. What are some success stories from your side?
Thank you, Pallavi. Hello, everybody, and thank you very much for the opportunity to participate in the annual meeting of HEI. On the Asian side, I think there has also been a lot of positive movement, particularly with regard to the transboundary air pollution. And as we know, in the South Asian region, particularly the Indo-Gangetic Plain, there is always this really bad problem of haze, particularly in the winter season, and also when the crop residues are being burnt. So there is a project, an initiative actually led by the World Bank, which is looking at that Indo-Gangetic region of Pakistan, India, Nepal, Bangladesh. So there is a movement in that space to try to really address that problem. There is also some rejuvenation of the energy within the ASEAN region as well, because the ASEAN region also has this issue of haze. So there is also sort of renewed energy and sort of re-strategizing on how to give more momentum to what has already been achieved so far. So a lot of positive developments in particularly the transboundary pollution. And in terms of like an actual example, I just wanted to share this series of projects that ADB had financed in the People's Republic of China, particularly in the Beijing, Hebei, Tianjin region, which was a really very important for economic development, but also the region which was contributing a lot of pollution to the country. So between 2015 and 2020, ADB financed a total of about $2.5 billion worth of projects. So it was a series of 8 projects with a combination of different kinds of financial instruments. And they were designed in such a way that they were done in a systematic and sort of cascading cross-sectoral approach, which kind of touched on all the key sectors which were highly polluting, and also the key cities and areas that were, that faced the worst pollution. So sort of in the beginning, the program began with looking at the policy and the regulatory environment, which then helped to strengthen the policy and regulatory systems, and then the capacity and institutional systems, which then created the enabling environment for having actual, clean air projects. So that was the systematic approach which was followed in the series of the 8 projects. And there has been a lot of success in terms of the actual reduction of the pollution levels, where in a matter of just 7 years, there was reduction in the PM 2.5 level by about 40%, sulfur dioxide reduction by about 74%, nitrous oxides by about 37%. So this was in the span of 2015 to 2022. So and another, I guess, example, a good positive story to share here is the role of the co-financing and many financial institutes working together, because there was also co-financing from the World Bank, from KfW, from AFD, and also the Green Climate Fund. And this is a program where we have a lot of valuable lessons, and we are really trying to draw the lessons and then apply it in other countries and other regions. So I'll stop there. Over to you, Pallavi.
Yeah, thank you, Karma. So again, like interest in funding the right things so that we can see the action that happens on the ground. And a key pillar in all of this often tends to be health information and how air pollution is affecting my health. Is it affecting my family members? And Nina, I know that's something you think about all day, every day. So success stories from you.
Thank you. Thanks, Pallavi. So I'm from Clean Air Fund. Can you hear me okay? Having trouble hearing myself. We as Clean Air Fund work for a world where everybody can breathe cleaner air. One of the things we do is fund and partner with organizations to promote data build demand and drive action for clean air, policy action included. We support decision makers around the world. We're working with the communities disproportionately affected and convening funders, politicians, businesses, and campaigners. One of our strategic objectives for 2026, or the overarching strategic objectives for 26, is to deepen and scale the impact to reduce fine particles and NO2 in line with the WHO guidelines. So that's moving forward. Subordinate to that is that this should be supported by clean air gaining recognition as a higher global health priority, which it currently is not, but slowly climbing up that agenda, I hope. So the example I've picked as kind of proof that we're moving in that direction is the Health Day at COP28 last year in Dubai. Health evidence was kind of central to that. I think we as a clean air movement worldwide had a lot to bring throughout the years preceding the first ever Health Day in Dubai. Just as one example, there was a lot of health evidence that was brought into the European Union discussion for the ambient air quality directives, which are almost adopted now, and we'd be quite pleased if they're adopted in the state that they're in at the moment. The Health Day, I mean, as I said, first ever day which had a specific focus on health at any COP ever, so it took us until the 28th COP to get there and have a health dedicated day, but there we go. Our CEO, Jane Burston, was invited to address the plenary of the Health Day, which there were more than 50 ministers of health in the room on the day, which is amazing. And a really strong focus on air pollution and climate change, that nexus and the co-benefits between the two. Off the back of that, 140 odd governments signed the Climate and Health Declaration, and Clean Air Fund was among the endorsers for the Climate and Health financing principles.
Fantastic. So we are seeing progress in many places, but this progress can only come if we have sectoral interventions. And as I think you've all heard, transportation is a sector that HEI has done a lot of work on over the years. So we wanted to take a look at how that sector is evolving in the African context and where we've seen successes. So Jane, please share some stories with us.
Thank you. I have two stories. Maybe two. There's still the echo. Maybe I don't know what you'll do about the echo. Yeah, that's fine. So I have two stories, and I think the very first one that has really been shared a lot in the recent past, you know, I would not do justice if I didn't talk about it, is the global elimination of leaded petrol or leaded gasoline in July 2021. This had been actually identified as the leading source of ambient lead in the countries that were still using leaded fuel. And the campaign to eliminate leaded gasoline started about, or ran for about 2 decades, and started, I would say, in 2002 with the formation of the Partnership for Clean Fuels and Vehicles. So what Martina said, the partnership approach, you know, collaboration, quite important, because this partnership brought together developed and developing countries, the oil sector, the vehicle industry, civil society, and the academia. At the time of its formation in 2002, the partnership, at the time of its formation, 117 countries were still using leaded gasoline. The initial focus of the partnership was Sub-Saharan Africa. Why? Because of the 49 countries, only one had eliminated leaded gasoline. So almost the entire, continent actually, or Sub-Saharan Africa, or they were still using leaded gasoline. And with support of UNEP and the partners, by end of 2005, so in just 3 years, the continent, Sub-Saharan Africa, had actually eliminated lead in gasoline. And after that, of course, with that momentum, we were able to engage the remaining countries. The last six countries, I would say, took longer, to phase out, with Algeria being the last country to eliminate lead in July 2021. So why is this a key success story? We had done a research, we supported a research that was published in the Journal of Environmental Health in 2012 on what the global benefits for leaded fuel phase out would be. And, there were 3 key benefits that were highlighted. The first, the health benefits would translate to about 1.2 million premature deaths avoided. Over 120,000 of these would be children. On the economic front, the economic benefits, 2.45 trillion US dollars per year saved, equivalent that time to about 4% of the GDP, global GDP. And lastly, there were also social benefits. Actually, US studies had been carried out linking high lead levels to crime, high crime rates. And, the phase out of leaded petrol would result to 58 million less male incarcerations and higher IQ, especially in children. So, avoided IQ loss in children would be around 320 million IQ points per year. So very huge benefits to the elimination. This actually gave the momentum to look at other activities or other policies, transport policies that would reduce emissions. The second example maybe that I could quickly give is a really more recent example. With CCSC funding, we were able to support the Eastern Africa Green Freight Corridor that connects 6 countries to develop or to update their green freight strategy. We had already supported them earlier on with CCSC funding to develop their 2017-2021 strategy, and this was the very first in Africa. So they've just updated that strategy, and we had a validation workshop last month, end of last month, and this will have significant impact because, as you know, the freight is one of the main contributors to PM, black carbon, accidents. So they've covered a whole lot of issues in that strategy. So I think those are the 2 examples maybe I can give for now.
Jane, that was really helpful, and I think I will highlight for a lot of the researchers who are in the room that with these changes that have come about, what has really been transformational is the science and the evidence that all of you have produced over the years. And I think the other big question, just in thinking about how will we carry this momentum of progress forward, it's important to reflect quickly for a few minutes on what were the inflection points. We often tend to say we have a lot of data, but we're not really seeing policy progress. And those inflection points can vary a lot, depending on sector, topic, question in mind. And I know we are standing between all of you and lunch, so we will be brief, but bear with us, because these are really useful stories to hear. So if I can start with you, Karma, air quality has been a known issue, but how and what really changed that information sharing? Was it evidence? Was it just will of people trying to do something? What are the 1 or 2 inflection points that you can think about in seeing this progress?
Yeah, thank you, Pallavi. So I think you sort of already alluded to it. It's the availability of data and all the amazing research work that organizations like Health Effects Institute and CCAC and the UN and World Bank. There's all these reports which are coming out more and more. So all the researchers in the room, many thanks to you. But within the data, I think it's the putting the economic and financial numbers out there, which I think is getting the attention of the decision makers, whether it's in the national governments or it's in international organizations, financing organizations. So I think it's really putting the economic value, and Martina had earlier mentioned the 6% of GDP figure in her opening remarks. So it's data like that, the $8.1 trillion, which is the value of the economic impact that is being caused by air pollution, and then trying to filter that data into what is relevant and understandable at a country level. I'm currently here in Jakarta, and there are studies that show that there were about 710 deaths that were caused in 2099 because of PM 2.5 pollution. And the economic cost of those impacts came to about 6.6% of the GDP of the country. So I think the economic linkages need to be made very, very clear. And as we all know, ultimately in the government, it's the Ministry of Finance or the Ministry of Economic Development which makes a decision on the kind of projects that are to be financed in the country. So I think this linkage with the economic impacts is really important, and that's what's grabbing the attention and helping to, I suppose, move the needle. The other, I guess, positive development is I notice an increase in the number of air quality champions across the world, whether it's in the national governments or whether it's at the city level or whether it's among NGOs, whether it's among common just your general public who is not part of any formal organization. There is overall much more awareness, and therefore the momentum is much higher. And because of that, I think in organizations such as in ADB, we are also having more equality champions within the organization, within our senior management, and therefore it's much I guess the momentum is much stronger, and it's much easier when there are many champions across many organizations, across many countries and regions. It builds a stronger case. So I think that is a very positive development in this space. Thank you.
Thank you, Karma. This is the third mention of economic costs and implications, so something for us to keep thinking about. Nina, your experience on inflection points.
I'm going to add a fourth mention of the economic costs. We did 3 things with grantees and partners in the run-up to COP28 Health Day. The first of which was a series of 6 case studies with vital strategies that looked at real-world success stories from 6 places around the world, different economic contexts, to show what could be done for both climate and health if you tackle them both at the same time, with engagement of the health authorities, with engagement of health NGOs, for better decision making. That got quite a bit of attention at COP28. It went into a solutions handbook that was circulated there and has picked up attention, including from the government of India, who want to be included in future editions, so that's great. We also worked with Global Climate and Health Alliance on an NDC scorecard. So the NDCs are the nationally determined contributions reports that all governments submit to the UNFCCC process. So ahead of COP28, most governments had done that. They did a kind of global ranking and a score of which countries were doing the best. What was, I think, particularly useful about the outcomes of that scorecard is that of the top 15 countries, there was only Chile in the top 15 that was actually a higher income country. All the others were low and middle income countries. So it was kind of a man bites dog story, and worked very well both in rich countries, because you could kind of get bashed by your own press, like, why aren't you doing better? And in poorer countries, like, well, our plans are kind of aligned for both climate and health at the same time, via air pollution. And then thirdly, via, again, Global Climate and Health Alliance and another one of our partners, Healthcare Without Harm, as well as with WHO, we coordinated some calls to action and open letters to the COP28 president, which respectively picked up around 40 million signatures, so mostly healthcare workers, so showing that the health sector and people working in hospitals and clinics and so on were really interested in better air quality for the sake of their patients. And yeah, bringing it back to the economics point, we've launched an initiative recently called Our Common Air, which is a commission of kind of elders in the world of clean air, including Helen Clark and Sumya Swaminathan, former chief scientist of WHO, and they're calling, among other things, for a stronger economic case for cleaner air. So absolutely back up the point that Karma shared.
Fantastic. Jane, what do you think have been some driving points for action?
I would say just the realization and reality of vehicle growth taking place in the global south. I'm sure anybody who's been to one of the cities, for example, in Africa, the traffic congestion, you don't even need to measure the growing pollution that is coming from or emissions that is coming from traffic. I think that has been the driving force. Congestion, the growing emissions from traffic has been really, a reality and been the driving force for a lot of the global south countries. And this is actually even collaborated. I think for those who would be interested, we've sort of like analyzed, we've supported many countries to look at over 70 countries, but in the front of fuel economy of passenger vehicles. And we've just published a report in December 2022 on these findings, comparing over 100 countries from the global north and south. And what we find is that from 2005, passenger car sales reduced at an annual rate of 0.7% in the high-income economies, while it expanded by an annual rate of 7% in low and middle income countries. So, of course, when you're looking at absolute numbers, the global north still has many vehicles, but we see the growth has actually shifted to the global south. What are the challenges in the global south? Poor fuel quality, and that's what we've been trying to address, for example, through some of the initiatives like the CCSC. You know, if you look at some of the African countries, the sulfur standard is still at 10,000 parts per million compared to the US, Europe at 10 parts per million. Again, very poor vehicle standards, you know, substandard, obsolete vehicles being imported or allowed into some of these countries. So these are the two leading factors that have actually acted as a turning point because of increasing vehicle emissions. And this is actually also collaborated. We find in a lot of the African countries, we don't have continuous air quality monitoring systems, but where there are some studies, you know, for example, Nairobi, there was a study that was undertaken by the University of Nairobi and some partners, and they found that about 39% of PM 2.5 is actually from traffic, and this number even includes dust. You know, so very high numbers when you're looking at the contribution of transport to air quality challenges, and this has been the turning point, I would say, for a lot of the African and the global south countries.
Thanks a lot, Jane. Juan, when you opened, you talked about interest in countries in the Caribbean and Latin America in addressing air pollution. Are there similar inflection points there or other things that have contributed?
Yeah, thank you, Pallavi. I think there are similarities, and I would like to highlight as an inflection point, the ability to conduct like health impact assessment at a country level or city level. Because we have these global estimates that tell us that 7 million people die because of air pollution. However, there is something a little bit of reluctancy in the countries because they don't know where this data is coming from, or a city level, they don't know where this data is coming from. But then when we start using the same methodology and the same science to do health impact assessment at a country, at city level, several things start to happen. First is like we now have a use for the data that both health and environmental authorities had. So they have this system in place, but they don't, they weren't using the data at the extent that they can do it. So now we have the opportunity to have together at the table also the health and the environmental sector. That it was a huge gain, especially to have the health sector on the table. Because usually what happened is like traditionally in most of the countries in Latin America and the Caribbean, this topic has been led by the environmental authorities. However, the health sector, we have the environmental authorities using the health sector, using the health argument without the health sector. So that created a credibility issue. But then when we were able to bring the health sector to the table, and then they were working together, the message that is coming from the health sector is very powerful. Sometimes the environmental message is a little bit seen as an activist message, and sometimes it doesn't get like good reception. But messages coming from the medical community and the health community, especially in countries in Latin America and the Caribbean, has huge acceptance. Actually, most of the changes to eliminate diseases in America has been implemented because the leadership of the health sector. So having both together, working together, has been a huge gain. And the related to that is the other point that I wanted to highlight is the ability to communicate this message to the general public. So now that we have like health data and health impact assessment, so people can finally understand what is this 10, 20, 25 micrograms per cubic meter of whatever. So now they say that, okay, this is creating asthma episodes. This is creating non-communicable diseases, COPD, so lung cancer. So this is something that is close to people, and now we have like these champions, as it was mentioned before. And this is also like policymakers, because they're also breathing this air. But now they understand that the air that is breathing is affecting their families, is affecting their own life, and of course their constituents. Thank you, Pallavi.
Great. Great. I think a lot of very fascinating, ways in which we've seen these changes happen, but underpinning all of it is always going to be data, information, and the evidence and the answers we need. So there's a lot more still for all of us to do. In the interest of time, we're going to forge ahead and, wait for some of you to answer any specific questions that you might have for Nina and Juan during the lunch break. They're both here for the rest of the day, so please find them. And if you want to connect with our online panelists, we will be very happy to connect you. So looking ahead, we've made some progress, but there's a lot more to be done. The air pollution problem is not going away. And Karma, from your point of view, what do you see as critical actions, critical decisions in the next 1 year? Let's go for the next year that you think will be transformational for the space.
Thank you, Pallavi. So one thing that we did not talk about too much here is the climate change movement. There is immense, pressure and activity and momentum in the climate change and the countries meeting their NDC goals and all these carbon neutrality commitments that are being made, announcements. And everything is so directly linked with air quality. So, but unfortunately, we're not seeing enough of that. And I think that this is a really low-hanging fruit because basically a lot of the mitigation measures for greenhouse gas emissions is also basically reducing air pollution. So what I would like to see is more integration of air pollution in the climate change movement. Whether it is, doing studies, data collection, data analysis, designing mitigation measures for the climate change projects to also include air quality in that, air quality and health in the dialogue, because it's usually you just need to have like one incremental step to make it like a whole holistic package where through a particular action, you're addressing climate change, air pollution, and health all at the same time. So that is what I would like to see in the next 1 year. Thank you.
Fantastic, thank you. Nina and Juan, since you're working with lots of different groups and at different scales, what do you see as important next steps to continue this progress? And Nina, perhaps I'll start with you and then come to Juan.
Okay, I think I can be quite brief on this one. So maybe 2.5 things in the next year. Firstly, there's going to be a resolution at the World Health Assembly already next month in Geneva on climate and health. So WHA 77, which we've been working on with some of our partners, and fingers crossed, I think that will be fine. We'll be quite pleased with it. There are several references to air pollution in there. So as Karma's saying, kind of the air pollution and climate change movements coming together. The Hafa thing is still to be confirmed, but potentially a health day at COP29 in Azerbaijan in November. And the other definitely big thing is a second global air quality and health conference hosted by WHO around this time next year, potentially a bit earlier, with the location and dates still to be confirmed, but definitely happening. There you go.
Juan.
Yeah, and I think like something that we would like to invest is in like capacity building for civil society organizations. So we want to make sure that there is capacity within the civil society, within the population, to use the data that is available, to understand it, and to demand action also from governments and for governments and from and private sector.
Great. And Jane, thinking about the transportation sector in particular, are there like top 1, 2 interventions that you think we absolutely need to continue this progress?
Definitely. For example, looking at Africa, a lot of the countries are still using high sulfur fuels. Vehicle emission standards are, at Euro 0. We've supported two sub-regions to implement at least a Euro 4, which is still low, but only 2 countries are fully implementing Euro 4 and above. So I think for us, the immediate term, as you spoke, 1 year, it would be to move to 10 ppm fuels and a Euro 6 vehicle standard. That would have the highest benefit. And then the second one, I think, to tie it to what Kama has spoken about, the need to link the climate and of course air pollution agendas, for us is the electric mobility, shift towards electric mobility. And here we see the highest potential in two areas. Maybe the shifts to 2-3-wheelers, electric 2-3-wheelers, because this is the highest increasing segment in a lot of the developing countries. Transport has collapsed, so shifting, and these are already technologies that are at par, at cost. And then the other one I would say is on soot-free buses. And the opportunities to move to electric buses, I think, are high there, and a lot of the cities are thinking about moving towards BRTs, bus corridors. So one of the things that we really are working with the countries or cities is, why don't they integrate or look at electric bus options where possible? Because I think that's where we would have the highest dividends in terms of clean air, better health, and of course climate.
Amazing. I'm very happy to hear air quality and climate change integration, more collaboration with lots of different groups. Thinking about soot-free buses, an area where HEI has been funding research in the last several years. And I think most importantly, what I'm taking away from this, and I hope you are too, is that a lot of the work that is happening on the scientific side is feeding into these decisions that are happening not just in the US, but around the world. So congratulations to everyone here who's contributed to it. And a big thank you to all of our panelists who've joined us from different parts of the world. So good evening and good night to Jane and Karma and Martina. Thank you so much for joining us, and we'll continue this conversation. And thank you, Juan and Nina, for being here and for sharing your experiences. And to everyone else, lunch is now ready. So please go ahead and get ready for the next session. Thanks a lot.